These are real consequences that will be felt in exam rooms, emergency rooms, and kitchen tables across our country. At NHMA, we stand in solidarity with members of Congress who are using every tool at their disposal to fight to save Medicaid and other essential programs and are fighting for science. Medicaid should not and is not a luxury. It is a lifeline for millions. And today, we reaffirm our commitment to protect it for our families, physicians, and for our community. I'd like to turn it over to my colleague, Ms. Susan.
Good morning, and thank you, Congressman Ruiz, for allowing us to be here today. My name is Susan Poland. I'm the Associate Executive Director for Public Affairs and Advocacy at the American Public Health Association. APHA champions optimal and equitable health and well-being for all. We speak out for public health issues and policies backed by science. We've been concerned about RFK Jr. since he was declared one of the dirty dozen of COVID misinformation. His lack of expertise and experience with a department as complex as Health and Human Services and positions not grounded in science, on top of a clear and misinformed agenda, are all the reasons we opposed his nomination. Since he's been secretary, he's led an illogical attempt to reorganize HHS agencies and slash or withhold important funding for state and local health departments, impacting not just our members, but even more worrisome, the health of the public. There's no strategy behind the reorganization. Critical programs like chronic disease prevention, climate change, women's health are all being folded into an agency focusing on treatment and not prevention, meaning we are expanding our sick care system and not building toward making America healthy. He has taken every opportunity to undermine evidence-based approaches to improving the public's health, starting but not limited to vaccines. We just heard a bit about ACIP. They're meeting this week. It's a group of unqualified appointees who will at best rubber stamp his agenda and at worst expand it. APHA is fighting back through the legal system and the court of public opinion against his anti-public health agenda. Just yesterday, we had a win in the courts, APHA versus NIH, in which the judge recognized the illegality of grant cancellations based on executive orders. And he's now extending relief to many of those canceled grants. We continue to fight in a number of other court cases to try and rebuild what has been decimated. We know we need to protect the public health workforce. Critical agencies like CDC, which focus on keeping people healthy through upstream, science-based prevention activities. We need to focus on funding for public health and research and treatment. When you look at the budget and reconciliation and fiscal year 2026 proposed funding, what you see is a system being squeezed at both ends, decimating the public health interventions that keep people healthy, coupled with reductions in access to care through Medicaid cuts and the ACA restrictions, leave millions of people without care and taxing the health care and health system beyond repair. People will end up in emergency departments as their only option for care, or even worse, people will die. This is a man who has already told us the public shouldn't take medical advice from him. We've been taught when someone tells us who they are, we should believe them. Kennedy has told us he cannot be trusted with the public's health. Let's believe him.
Thank you. And at this point, we're going to close the press conference. And if you have any questions, we can take them individually with the reporters that are here. Thank you very much.